Assalamualaikum warahmatullahi wabarakatuh. So, my name is Nurul Syafiqah binti Jamaluddin, matric number 1201819. So, today we want to explain the topic of the understanding of anxiety disorder in mental health information. So, first we want to highlight the meaning of mental health. Mental health is a state of mental well-being that enables people to cope with the stress of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individuals and collective abilities to make decisions with relationship and also shape the world we live in. Mental health is a basic human right. As we know, there are many types of mental health disorder, but in this presentation, we just want to focus about the anxiety disorder. There are many types of a directory of information sources about that explain about the terms of anxiety disorder. There are some examples, the sources of information that we found the meaning of anxiety disorder from the journal and also website. We also give some examples, the reference from journal and also website. Then we also found the information about the anxiety disorder from book of Harris Rose. This book provides scientifically proven technique to reduce stress and worry, rise above fear, doubt, and insecurity. So next we go to the next part, the type of anxiety. There are many types of anxiety, but in this presentation, we just want to focus the three types of anxiety, which is panic disorder, social anxiety disorder, and also separation anxiety disorder. There are several information that we found about the meaning of panic disorder from journal and also website. This is the reference that we found from journal and also website. Then we go to the next part, the of type of anxiety, which is social anxiety disorder. We found the information about the meaning of social anxiety disorder from two resources such as journal and also website. This is some of example. Next, we go to the last part, type of anxiety, which is separation anxiety disorder. We found the meaning of the terms is from journal and also website. In this presentation, we state two of reference from journal and also website.
My name is Nur Amirullah binti Isa, matric number 1201807. So, there are four symptoms of anxiety disorder. First one is apprehension. It is about constant irritational anxiety about regular occurrence, events or persons, even when there is no apparent cause for worry. Second, muscle tension. Muscle aches and pain, especially in the neck, shoulders or back, as well as feeling of stress or tightness in the muscle. Third, difficulty concentration is defined as having difficulty concentrating, having trouble making judgment, or having trouble remembering things. Fourth, palpitation is the sensation of an abnormal or irregular heartbeat. Is known as palpitations. Firstly, we go to apprehension. There are two directories, which is from a journal and website. First one is from journal from Mary T. Benich and Lisa L. Smith, 2020. It is about the current study examine how individual difference in underlying traits related to internalizing disorders influence brain activation as well as unspecific factors into account low positive effect, anxious arousal, and anxious apprehension. Second, through a website, it is about briefly provide the overview about anxiety and the several common and physical symptoms of anxiety and also how to overcome it. Second is muscle tension. There are also two directories which is from books and journal. Books is generalized anxiety disorder which is GAD, is characterized by excessive worry that is difficult to control, accompanied by physical symptoms including restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, or sleep disturbance. Next, journal. The aim of journal research is a highlight on the anxiety signs, symptom, etiology, pathology, treatment. It is associated with restlessness, feeling key up or on edge, being easily fatigued, difficulty in concentrating, or mind going blank. Third is palpitation. There are three directories, which is from journal, book, and website. Journal. This wishes to determine the etiologies of palpitation. The usefulness of diagnostic test is determining the etiologies of palpitation and the outcome of patient with palpitation. Book. This chapter describes the symptom and diagnosis of palpitation. Website. The website highlighted the definition of palpitation and the causes of palpitation. Fourth is difficulty concentration. There are two directories, which is from journal and books. Journal is about the article explore anxiety and stress experienced by first semester nursing student and identify source of support during a transition from a face to an online learning platform during the first month of the COVID-19 pandemic. The most reported symptoms were difficulty concentrating, which is 90%. Second, books. This report examined the percentage of adults aged 18 and over who experience symptoms of anxiety. Generalized anxiety disorder, which is GAD, is characterized by excessive worry that is difficult to control accompanied by physical symptoms. There are five factors of anxiety disorder. First, environmental factor. People that have traumatic events, stressful living second term. For example, incident of physical or mental abuse, the loss of a loved one and others. Next, stress build up. Stress build up refer to the gradual accumulation of stress over time. It occurs when the demands and pressures placed on an individual exceed their ability to cope effectively. Next is genetic. Some genetic flaws or predisposition can increase a person's susceptibility to anxiety. Next is co-occurring disorder. Co-occurring disorder is stress due to an illness. This issue could interact and make anxiety feeling worse. And finally is personality traits. For instance, people with perfectionism, low self-esteem, excessive self-criticism, or a propensity to overthink may be more prone to anxiety. So, first one is the environmental factor. So, there are two directories, which is a journal and website. The journal is from the Barbara Montage in 2020. The aim of this systematic review was to provide insight in inhibitory control, preparatory response inhibition, and inference control in trauma-exposed youth from a developmental perspective and exploring the effect of prolonged stress. And the website is provide information about the causes of anxiety and specifically about the environmental factors. Second is a stress build up. There are also two directories from a journal and website. From the journal is from Muhammad Mufateh in 2021, which is aim of this review was to investigate present literatures to identify risk factors associated with stress, anxiety, and depression among university undergraduate students in developed and developing countries, and website also determining which one are experiencing in critical to finding an effective treatment plan and feeling better whether the stress or anxiety. Third is personality trait. There are two directories which is from the journal and book. From journal is from the Court of Argames, which is in 2010, is about the study performed through a quantitative review of association between the higher order personality traits in the Big 3 and Big 5 models and specific depressive anxiety and substance use disorders in adults. And book was focused to examine the prognostic value of personality dimension and negative and positive life events for dignities and symptom cause trajectories in depressive and anxiety disorder. Is genetic. There are three directories which is from journal, books, and website. First one is from journal, which is from Hetema in 2005. We discuss about anxiety disorder comorbidity by examining the structure of the underlying genetic and environmental risk factors. And second is from book. The book provides an update on the origins and the causes of anxiety disorder and their related symptoms. And third one is through a website, which is provide overview of anxiety, the causes, symptom, and the treatment for anxiety. And the last one is co-occurring disorder. There are two directories from journal and website. First one through a journal. The journal was aimed to provide a review of the current state of the literature on the treatment of co-occurring anxiety and substance use disorder. This review includes a brief overview of the epidemiology of this co-occurrence, challenges in assessing anxiety in the context of a substance use disorder, evidence for treatment approaches, and new advancement and future directions in this understudied area. And next, through a website, complete the brief about the understanding of co-occurring disorders. And the last one is co-occurring disorder. There are two directories from journal and website. First one through a journal. The journal was aimed to provide a review of the current state of the literature on the treatment of co-occurring anxiety and substance use disorder. This review includes a brief overview of the epidemiology of this co-occurrence, challenges in assessing anxiety in the context of a substance use disorder, evidence for treatment approaches, and new advancement and future directions in this understudied area. And next, through a website, complete the brief about the understanding of co-occurring disorders.